Yes. Get started.
Good morning, everyone. My topic for the presentation is
Make some comment.
good morning, everyone. My topic for the presentation is diagnostic criteria for generalized anxiety disorder, and my moderator is Dr. South. Generalized anxiety disorder. It is usually characterized by excessive worry or anxiety about multiple issues which linger 6 months or more, that is uncomfortable to the point of interfering with daily life. There are some of the symptoms that excessive anxiety and worry, fatigue, restlessness, increased muscle aches or soreness, impaired concentration, irritability, or difficulty in sleeping. Guidelines of ICD-10 for generalized anxiety disorder are: there must be at least 6 months symptoms of prominent tension, worry, and feelings of apprehension about everyday events and problems. At least 4 of the following symptoms must be present, at least from 1 to 4. First is autonomic arousal symptoms: palpitations, sweating, trembling, dry mouth. Second is symptoms involving chest and abdomen. There are difficulty in breathing, feeling of choking, chest pain, nausea. Third is symptoms involving mental state. There are feeling of dizzy, derealization or depersonalization, fear of losing control, fear of dying. Fourth, general symptoms: hot flushes, cold chills, numbness or tingling sensation. Fifth is symptoms of tension, muscle tension or aches and pains, restlessness and inability to relax, feeling keyed up, a sensation of lump in throat, difficulty in swallowing. Sixth, other non-specific symptoms: exaggerated response to minor surprises, being startled, difficulty in concentration, maybe going blank, persistent irritability, and difficulty in getting sleep because of worry. Doesn't meet the criteria for panic disorder, phobic anxiety disorder, OCD, and hypochondriasis. Anxiety disorder is not due to physical disorder or substance abuse. Guidelines of DSM-5 for generalized anxiety disorder are: excessive anxiety and worry, apprehensive expectation. So there are 6.
All 6 should be present.
No, sir. There should at least 4 present from 1 to 4. At least from 1 to 4, there should be 4 symptoms present.
You've taken it from which one? ICT diagnostic criteria for research or the blue book? Blue book का पैसा नहीं है. लिया. ICT की Dr. Sattva, what do you say? The blue book.
Excessive anxiety and worry, apprehensive expectation, occurring more days than not for at least 6 months, about a number of events or activities, such as work or school performance. The individual finds it difficult to control the worry. The anxiety and worry are associated with 3 or more of the following 6 symptoms, with at least some symptoms having been present for more days than not for the past 6 months. And only one item is required in children. First, restlessness or feeling keyed up or on edge. Second, being easily fatigued. Third, difficulty concentrating or mind going blank. Fourth, irritability. Fifth, muscle tension. And sixth, sleep disturbance. Difficulty falling or staying asleep, or restlessness or unsatisfied. D, the anxiety, worry, or physical symptoms cause clinically significant distress or impairment in social, occupational, or other important areas of function. Fifth, the disturbance is not attributable to the physiological effects of a substance, example, a drug of abuse, a medication, or another medical condition, example, hyperthyroidism. The disturbance is not better experienced by another mental disorder. There are some of the examples. First, anxiety or worry about having panic attacks and panic disorder, negative evaluation in social anxiety disorder, contamination or other obsessions and obsessive compulsive disorder, separation from attachment figures and separation anxiety disorder, reminders of traumatic events, and post-traumatic stress disorder. Gaining weight in anorexia nervosa, physical complaints and somatic symptoms, perceived appearance flaws in body dysmorphic disorder, and having a serious illness and illness anxiety disorder or the content of delusional beliefs in schizophrenia or delusional disorder. 0.9% among adolescents and 2.9% prevalence in US. Symptoms in GAD may be wax and wane across the lifespan. Rate of full remission very low, may be overdiagnosed with children. There's some of the risk factors: the temperamental, behavioral inhibition, negative affectivity, and harm avoidance, the expression of the disorder. Environmental, parental overprotection, genetic. 1/3 of the risk in GAD is genetic, overlaps with the risk of neuroticism. Culture-related, somatic symptoms predominate in the expression of the disorder. Gender-related, frequently in females than males, they were confirmed with unipolar depression, whereas male comorbidity substance. Guidelines of ICD-11 for GAD, generalized anxiety disorders characterized by marked symptoms of anxiety that persist for at least several months, manifested by either general apprehension, that is free-floating anxiety, or excessive worry focused on multiple everyday events, most often concerning family, health, finances, and school or work, together with additional symptoms such as muscular tension or motor restlessness, sympathetic autonomic overactivity, subjective experience of nervousness, difficulty maintaining concentration, irritability, or disturbed sleep. Symptoms result in significant distress or significant impairment in personal, family, social, educational, occupational, or other important areas of function. The symptoms are not a manifestation of another health condition and are not due to the effects of a substance or medication or in the central nervous system. There are my references.
Good morning, everyone. My name is Dr. Anuj Kataria and my moderator is Dr. Asta Jain, and our topic is major NCDs. Objectives are introduction to neurocognitive disorders, types of neurocognitive disorders, understanding major NCDs, and comparing them with respect to DSM-5 and ICD-10. So according to DSM-5, NCDs begin with delirium and are followed by symptoms of major NCD, mild NCD, and their etiological subtypes. The major or mild NCD subtypes are NCD due to Alzheimer's disease, vascular NCD, NCD with Lewy bodies, NCD due to Parkinson's disease, frontotemporal NCD, NCD due to traumatic brain injury, NCD due to HIV infection, substance medication-induced NCDs, NCDs due to Huntington's disease, and NCDs due to prion disease, and NCD due to another medical condition. However, NCD due to Alzheimer is the most common. The NCD category encompasses a group of disorders in which the primary clinical deficit is in cognitive function and that are acquired rather than developmental. However, cognitive deficits are present in many, if not all, mental disorders. Example, schizophrenia, bipolar disorders. Only disorders whose core features are cognitive are included in the NCD category. The NCDs are those in which impaired cognition has not been present since birth or very early life, and thus represents a decline from a previously attained level of functioning. The diagnostic criteria for major neurocognitive disorders are evidence of significant cognitive decline from a previous level of performance in one or more cognitive domains based on concern of the individual, a knowledgeable informant, or the clinical that there has a significant decline in cognitive function, a substantial impairment in cognitive performance, preferably documented by standardized neuropsychological testing, or in its absence, another quantified clinical assessment. The cognitive deficits interfere with independence in everyday activities, that is at a minimum requiring assistance with complex instrumental activities of daily living, such as paying bills or managing medications. The cognitive deficits do not occur exclusively in the context of a delirium. The cognitive deficits are not better explained by another mental disorder, example, major depressive disorder or schizophrenia. Now, the most common one, the major NCD due to Alzheimer's disease. A diagnostic criteria is the criteria are met for major or mild neurocognitive disorder. There is insidious onset and gradual progression of impairment in one or more cognitive domains. For major neurocognitive disorder, at least two domains must be impaired. Criteria are met for either probable or possible Alzheimer's disease as follows. Diagnostic criteria: probable Alzheimer's disease is diagnosed if either of the following is present, otherwise possible Alzheimer's disease should be diagnosed. Evidence of a causative Alzheimer's disease genetic mutation from family history or genetic testing. All three of the following are present. There is clear evidence of decline in memory and learning and at least one another cognitive domain based on detailed history or serial neuropsychological testing. Steadily progressive gradual decline in cognition without extended plateaus. No evidence of mixed etiology, that is absence of other neurodegenerative or cerebrovascular disease or another neurological, mental or systemic disease or condition likely contributing to cognitive decline. Other one is major frontotemporal neurocognitive disorder, and the diagnostic criteria according to DSM-5 is the criteria are met for major or mild neurocognitive disorder. The disturbance has insidious onset and gradual progression. It has either a behavioral variant or a language variant. According to the behavioral variant, three or more of the following behavioral symptoms should be there: behavior disinhibition, apathy or inertia, loss of sympathy or empathy, perseverative stereotype or compulsive ritualistic behavior, hyperorality and dietary changes, prominent decline in social cognition or executive abilities. In the language variant, prominent decline in language ability in the form of speech, production, word finding, object naming, grammar, or word comprehension. Relative sparing of learning and memory and perceptual motor function. The disturbance is not better explained by a cerebrovascular disease, another neurodegenerative disease, the effects of a substance or another mental, neurological or systemic disorder. In the major vascular neurocognitive disorder, the diagnostic criteria according to DSM-5 says the criteria are met for major or mild neurocognitive disorder. The clinical features are consistent with the vascular etiology as suggested by either of the following. Onset of the cognitive deficits is temporally related to one or more cerebrovascular events. Evidence for decline is prominent in complex attention, including processing speed and frontal executive function. There is evidence of the presence of cerebrovascular disease from history. Physical examination or neuroimaging considered sufficient to account for the neurocognitive deficits. The symptoms are not better explained by another brain disease or systemic disorder. Not dementia. This is the dementia according to the ICD-10 classification. Dementia is a syndrome due to disease of the brain, usually of a chronic or progressive nature, in which there is disturbance of multiple higher cortical functions, including memory, thinking, orientation, comprehension, calculations, learning capacity, language, and judgment. This syndrome occurs in Alzheimer's disease, in cerebrovascular disease, and in other conditions, primarily or secondarily affecting the brain. Dementia produces an appreciable decline in intellectual functioning and usually some interference with personal activities of daily living. The diagnostic guidelines according to ICD-10 are the primary requirement for diagnosis is evidence of a decline in both memory and thinking, which is sufficient to impair personal activities of daily living. The impairment of memory typically affects the registration, storage, and retrieval of new information, but previously learned and familiar material may also be lost, particularly in the later stages. There is also impairment of thinking and of reasoning capacity and a reduction in the flow of ideas. The processing of incoming information is impaired in that the individual finds it increasingly difficult to attend to more than one stimulus at a time. The most important thing is that the above symptoms and impairment should have been evident for at least 6 months for a confident clinical diagnosis of dementia to be made. The dementia and Alzheimer's disease and the diagnostic guidelines according to ICD-10 are the presence of a dementia as described before, insidious onset with slow deterioration. While the onset usually seems difficult to pinpoint in time, realization by others that the defects exist may come suddenly and apparent plateau may occur in the progression. Absence of clinical evidence or findings from special investigations to suggest that the mental state may be due to other systemic or brain disease. which can user dementia. Example, hypothyroidism, hypercalcemia, vitamin B12 deficiency, niacin deficiency, and etc. Absence of a sudden epileptic onset or of neurological signs of focal damage, such as hemiparesis, sensory loss, visual field defects, and incoordination occurring early in the illness. Now, vascular dementia, the diagnostic guidelines are the diagnosis exposes the presence of a dementia as described above. Impairment of cognitive function is commonly uneven so that there may be memory loss, intellectual impairment, and focal neurological signs. An abrupt onset or a stepwise deterioration, as well as the presence of focal neurological signs and symptoms, increases the probability of the diagnosis. Associated features are hypertension, carotid emotional lability with transient depressive mood, weeping or explosive laughter, and transient episodes of clouded consciousness or delirium. Thank you.
What is mild cognitive disorder?
The diagnostic criteria is different for a mild disorder in both the DSM-5 and ICD-10. It's divided in 3: delirium, major, and mild. So it's completely.
What is the difference between mild and major? Anxiety. What is pre-coping anxiety? Okay, and did you understand what is pre-coping anxiety? ICD वाला बता pre-coping anxiety क्या होती है? Anxiety is not associated with a specific situation, or it is not associated with specific symptoms. आपने उसमें rule out करने के लिए number of instances दिए anxiety के, panic attacks की anticipatory anxiety नहीं होती है, OCD में जो obsession से तब anxiety नहीं होती, it is not attached to something, it's just there, unattached, free flow, like specific phobia. For example, somebody has a phobia of dogs, so if the dog is barking, he will anxiety. That is not anxiety. Okay, so patients of OCD, for example, they are very, can say, try to hide their symptoms. But they need to, or they will think that this symptom of TB is my habit of TB. So you need to associate that the anxiety is not attached to something. It is not associated with something. GAD, it is the context is anxiety. Okay, for example, there is a disorder in children called separation. So they are afraid if the parents go, if somebody is out of house, they are very anxious, waiting for them to get back. Okay. That's the protein is that it is not attached to something. Okay. You have to look at GAD, I think that ICT, then there are 4 criteria mentioned.